been on Ultimate Health before, you know. Ultimate Health on Joy 99.7 FM with me, Nortey by nature. Obviously, you know I got a big God, right? Coco for him.
Joy 99.7 FM.
I had wanted to play in Tuntumbewu by Rex Gemfi, right? But I kind of left that out. Ultimate Health on Joy 99.7 FM. Listen every Sunday, 2:05. We are live. If it impacts on your health, your well-being, we'll definitely talk about it. Bringing in the professionals, practitioners. And we're doing just that today. Yesterday was World Malaria Day, 25th of April. We've done this for years, huh? I'm sure you recall when we switched from chloroquine to the artemisinin-based combination therapies. 2005, we had a big fight here, huh? 1998, we had Rollback Malaria Partnership. Oh boy. Now we are driven to drive out malaria. Now. So what have we been doing, right? What's been Ghana's progress over the years and how are we marking World Malaria Day? You can't watch TV without a mosquito coil advert or an insecticide advert. So I'm joined in the studio today, Dr. Prince Henry Opoku. He's a public health specialist at the Kolebu Teaching Hospital, and he's also with the Health Promotion Unit, Public Health Department of Kolebu. Next to him, I have Victoria Jade, Public Health Nurse, Kolebu Teaching Hospital, and she's with the Internal Medicine and Therapeutics Department. We're talking malaria.
Like, seriously?
You're welcome.
Thank you.
Can you move your mic up a bit, Dr. Opoku? Prince Henry Opoku and Victoria. You know, these are royal family names. Queen Victoria, Prince Henry and all that. Are you sure you're Ghanaian?
Full Ghanaian.
Full Ghanaian. Oh, your mics are a bit on the low side. Yeah, speak again.
Full Ghanaian.
Full Ghanaian. Okay, I still have you a bit soft. I'll sort that in a minute. And Victoria, full Ghanaian.
Yes, please.
Okay, right. Ziggy, I still have a little hollowness in their mics. Let me just speak again.
Yes, please.
Okay, there you go. All right. And Prince Henry.
Yes,
Okay,
full
now,
Ghanaian.
much better. Full
Yeah.
Ghanaian. Okay,
Yeah.
okay. Just teasing.
Yeah.
But World Malaria Day is serious business. Okay.
Yeah.
I've been sitting in this chair for several years, past 2 decades. Okay. So I've chronicled some of the things we've done, some of the things we've heard. All right. But generally, I think the average Ghanaian does not take malaria seriously. Right. So let's go into it. What's been our tale of the tape? Have we really been able to impact on the numbers before we look at the strategies? Okay. Have we really been able to drop the numbers? I know there are countries, I think about 30 something countries that are malaria free, declared malaria free, right? But how's Ghana doing?
Well, let me begin the conversation. So, just to chip in or just to come in from where you have set the conversation
Okay.
to, the picture with malaria has not been the right projection that we have looked at. Like if you look at the WHO strategy from 2016, the global strategy generally, I'll narrow it to Ghana, was to have malaria eradicated by the year 2030.
Right.
So from 2016 up to 2030, that was the target. But you know, when we got to when we had like intersections with things like COVID-19, and you know, when other diseases come up, they sort of take off the attention of malaria.
Are you saying that because of COVID,
It's not just because of COVID.
we have
yes.
a national malaria program? It's
That's
always
right.
been there.
That's right.
Okay. So I'm just trying to see. I mean, we even now have a vaccine.
Yes.
There have been several benchmark, should I say, achievements.
Yes.
Okay.
Yes.
So Ghana has been derailed. Is that what you're saying?
Yes. So the derailment is not just because of COVID, like I initially said. Sometimes you look at funding. Sometimes you look at what will interest the partners in coming together
But
to.
the partners, Doc, you know, I'm very passionate about this.
Yeah,
the
I get
partners
you.
are partners. You know, we had Global Fund, we had all these things. HIV is saying the same thing. As
Yes.
soon as Global Fund, Bill Gates Foundation pulled out, then we are not ready to look after our own people. Because we have our own money. Listen, when we changed from chloroquine to artemisinin base, one of the reasons for our choice was that to keep our local pharmaceuticals in the business.
Okay.
Because malaria is big money.
Okay.
Okay? So what is our excuse?
So I think that will have to do with our national policies
Hey.
to look at it from a different angle, because at the end of the day, if malaria is an endemic disease, that means it stays more within our sub-Saharan African region.
Okay.
So once it's here, we as a people must also be ready to join in the fight. But you should ask yourself how much of our national budget is
I'll ask you.
dedicated towards malaria.
I'll ask you. Straight off.
You see, so it all has to do with funding, our interest, our
Okay.
sensitization, like we are doing now.
Okay,
Yes.
let me tackle the mosquito instead of
Okay,
tackling
sure.
you.
Okay, that's
Right?
fine.
Because I think we have policies, right?
Okay.
And so when you talk about, malaria and pregnancy and things like
Okay,
that, these are pregnant Ghanaian women,
Yes.
okay?
Vulnerable.
And we
Yes.
know they are vulnerable.
Yes.
When we talk about under 5 mortality, and malaria is a big driver in there, right?
Yes, yeah.
These are Ghanaians,
Yeah.
okay? So I do understand the contribution of donor partners,
Yeah.
but I will not understand or tolerate when it is like we fold back and we allow it to, it's like saying cholera has come back because we don't have donor or partner support. So our policies, and I'm saying this so that my listeners, when they call in, will also share.
Okay.
Our policies must reflect what we have,
Okay.
what is endemic,
Okay.
right? Endemic means we live with it,
Yes.
right?
Yeah.
Apart from some kind of immunity we may have, right? But we still have to work on malaria.
Yeah.
And we've done a lot of work. So that's what I'm looking at. What have we done? What has worked? What hasn't worked?
Okay.
So that it doesn't seem like I'm harping on what hasn't worked, right?
Okay. So
Because I see all your flyers on, antenatal, test it, detect it, treat it, and all that.
Yeah,
I
and
know
the
where that
fives.
is going.
Yeah.
All right. But what have we done well? What are our numbers looking like? Other
Like,
countries
what do you want
have gone further to declare malaria free.
Okay.
I mean, both of you can take the questions.
Okay, so recently, let me start from the countries. Recently, I think it is Egypt and Cape Verde that have been declared malaria-free by WHO. They were just certified in 2024.
Okay.
That means that it's possible for us to Ghana to reach them. Now, look at what has been done. We can use that to broadly look quickly at the history of malaria, how it all started. Then we can now trace the interventions, or I would say we can take it from a description to a prescription point of view. So
Okay.
what is the description of malaria? So malaria is one of the oldest diseases that humanity has gotten to know. So malaria started, it started somewhere around the 1600s. That's when people realized that people were having fever, chills, rigors, and all the known symptoms that malaria comes with. Then in the 18, so over the back then they were treating, those days they would be the medieval ages, they would be treating with herbs, and that's were made from that contain substances like the quinine, the same thing that was engineered into the pharmaceutical treatment. So when in around 1880 thereabout, that was when a scientist picked up the parasite in the blood of people who had these symptoms. Then the progress started from there. Then in somewhere 1897, I think it was a British doctor. I don't want to give so much details, but I want to get the picture right. So the British doctor realized that it was a mosquito, specifically the female Anopheles mosquito, that was carrying.
What you're tracing is the whole antecedents and the vector being identified,
Yes, then
and so on and so forth.
then I'm
Okay.
I'm tracing it to tailor it down through the interventions because
But you see, to cut the journey
sure.
short,
Okay.
the average Ghanaian knows the mosquito,
okay,
right?
yeah,
They know the type of mosquito. They will
Mosquitoes,
can even zero down to the female mosquito.
Anopheles mosquito,
Anopheles,
yes.
and
It's taught in all schools.
Right,
So
we don't want to do that
Okay,
today.
sure.
All right, we are looking at World Malaria Day, and it says driven to end malaria.
okay,
All right,
okay.
the drive is what I'm looking at.
Okay, so the drive began in 1955 when WHO decided that let's come together. Now we know everything, like I was trying to give. We know everything. We know that everybody knows it's the mosquito. Everybody knows the parasite. Even most people can recite the name of the common parasite. That's the Plasmodium falciparum. Now the drive started from there. So WHO couldn't get most of the things articulated together until somewhere around the year 2000, where the rollback malaria program started. So now look at rollback malaria. It was dealing with the bed nets. So we're using insecticide bed nets around that time. We're doing the ACTs, that's artemisinin combination therapies that you rightly mentioned. Then also clearing stagnant waters and the environment. Now fast forward to about the year 2020, 2021. Then vaccines came into the picture. So now we have malaria vaccines, which are part of the expanded program for immunization. That's our EPI schedule, where under fives, for example, are being given vaccines against malaria. So they take it up to about 18 months, and that is okay. So those are the things that have been done, and of course,
What is our coverage when we talk about some of these interventions? All right. For example, and Victoria, feel free to chip in. You seem like you want him to, right? But what is our coverage when we say mosquito nets? We had a whole drive, right? Schools were giving it out. There's treated mosquito nets, insecticide treated mosquito nets, right? We all know what they are. Can you give me the coverage? How many Ghanaians are sleeping? I have a problem with the under. I think you sleep in the net, but they say under. Okay. How many are using this properly and efficiently and effectively?
Victoria, would you want to?
Do we have the statistics for that? Can we give? You see, because when we run an intervention which is targeted and designed to end something, then we must be monitoring it.
Yes.
Right? We gave out, let's say, 30,000, 30 million, or 3 million nets.
Bed nets. Yeah.
What is the yield?
The acceptance.
What did we get? Is it
and all that.
accepted? Is it this? We've had the TV videos and
So currently,
showing
to
it being
cut
watched
you
and all
short,
that. Yeah.
currently the bed nets are being given out for free, targeted at.
I know all that.
Under
I'm just saying
fives
that
and the
what
pregnant
is
women.
the yield? How can we, if I go to a WHO site, for example, it will give us averagely how many people estimated or projected to be using these properly.
Bed nets, yeah.
All right. How many households have residual whatever the wall spraying?
You have figures.
Right. Okay.
I
Because
would-
for me, that is what will scare the mosquito.
Yes.
Right. That is what shows whether we are driving or we are living with malaria, whether we are ending it or not.
Okay.
Okay.
Yeah.
Because you are coming from a public health standpoint.
Yeah.
So public health, we are looking at, prevention and all these tiers of, intervention. So we don't know how many people estimated in Ghana use
The bed nets.
the bed nets.
That figure I cannot.
We don't
give
know how
you
many pregnant
of
women use the bed
bed
nets.
nets. Yes.
Then are we serious?
Oh.
Victoria,
Yes.
bail us out. I'm very harsh on these
I
messages
get you.
because
I
I
get
give
you.
a lot of airtime. I don't mind if you come 3 times in this month, right? But where are we as a country? Because I've done programs. There was a woman who set up a memorial foundation because she lost her daughter. I remember the girl was around, was it 16 or 15? Way back. Okay. So, yes, complicated malaria can be a big thing, but we're even talking generally. We don't have these parameters.
I think we have to get back to you
Okay.
on that one.
All right.
It's a
Okay,
it's
so
a nice,
what are we doing?
it's a
What are
nice
we
to-
doing for this celebration?
Okay, so
Because I'll see T-shirts. I'll see zero. What does the T-shirt say? Zero malaria starts with me.
yeah.
Okay.
So for Kolebu like this. We have our objective that we are driven at.
Okay.
It's all based down on behavior change.
Okay.
So on the 25th of April, as you said, we had a program at Kolebu, Malaria Day with Wellness Day, where patients, relatives, staffs, and other people came around. We screened them for malaria, Hep B, Hep C, for free.
Okay.
Then the bed nets, some were given to the beneficiaries.
Okay.
So for Kolebu, we have the net that we give to pregnant women when they come for antenatal for the first time. We demonstrate to them how to use it, how to take care of them when it's torn, the way they should take care of them for it to last for them. Then the children at child welfare clinics, we give them the 8 RTSS. We start at 6 months. The second dose is taken at 7 months, then 9 months and 18 months. Then at the 18 months, we give the children bed net as well.
Okay.
Then with the pregnant women, as I've said, they give them SP, which is the sulfadozin parametamine that we give them at the first time they heard of quickening. That some people have it at the 16 weeks. So with that, we give it to them till they deliver.
Okay.
So with that one to prevent the mother and the child from getting this malaria. So as the children too, sometimes we do these school programs that we share the bed net for them at the school as well.
Okay. All right, great stuff. If you just joined us, just a sec. Great stuff. If you just joined us, Ultimate Health on Joy 99.7 FM. My name is Nortey by nature. I'm in the studio with Dr. Prince Henry Opoku, public health specialist with the Kolebu Teaching Hospital and the Public Health Department or Health Promotion Department as well. Next to him, Victoria Jade, public health nurse, right, with the Departments of Internal Medicine and Therapeutics, but they are all promoting some of the strategies, interventions that Ghana has rolled out over many years, but should I say enhanced, especially as we celebrate World Malaria Day, which was yesterday. Okay, you may think I'm being a bit harsh, but yes, I'm not Anopheles, but I will bite. Okay, because we do these periodic annual celebrations. We print T-shirts. I've sat on committees where I've refused to print T-shirts because I felt we could push that money somewhere else. Because I've done programs where T-shirts are left over or left in people's offices, right? But anyway, they are giving us what we are doing to spearhead the drive to end malaria. Mind you, there are countries that have been declared malaria free. They have driven malaria out. I don't know whether the mosquitoes left those countries and came to Ghana, right? But we're looking at what Ghana is doing and what you individually are expected to be doing. That's why I've got my guest in the studio. If you have any questions, concerns, WhatsApp is 055 11 11 997. Phone line 030 221 6541. Ultimate Health on Joy 99.
99.7 FM.
That's what I was going to say. Okay, so back to Queen Victoria and Prince Henry in the studio. Okay, so let me, drive in there.
Okay.
So for example, postnatal, and we have weighing, right?
Yeah.
The children after birth are brought in, and you're saying periodically we are giving the preventive treatments, right? You mentioned the stages, the months and so on, 6 months and so on and so forth. You have what we used to call your yellow card, but your weighing card tracks all of these things, doesn't it?
Yes.
Yep.
Please.
Okay. So that is why I'm a bit amazed. I'm a bit, curious that if all these records and the returns are being sent in, because my mom was a midwife, my late mom, and our home was a weighing center. So if you come for antenatal and you're receiving all these interventions, malaria targeted interventions, then we should have the data. We should be able to say this number of people have received bed nets, this number of people have been followed up and are sleeping on the bed nets. Okay. But again, we are giving the children under 5 certain, preventive measures to make sure they don't get malaria. We are also giving pregnant women are also getting malaria
SP.
prophylaxis,
Yes.
right? The SP and all those things, right? At particular stages. Okay. My question is, I do know that the attendance at antenatal is way, way higher than postnatal. So we'll lose quite a number of them. But for those who present at antenatal, what is our coverage? What is it looking like? Because you mentioned resources. Do we have the nets? Do they receive them? Are the nets acceptable to Ghanaians? For example, we did a lot of work on female condoms. They were not found to be acceptable, though we spent a lot of money. So that's what I'm trying to get at. Are our nets acceptable? Indoor, residual, whatever, spraying. We had a company that partnered us, right? Is it ongoing? Have we stopped? Has it been found to be a key, should I say, component, which is helpful?
So generally, with every intervention, there would be some acceptance rate, and there will be some people give obvious reasons why they would not want to use, let's say, bed nets and other or accept other interventions. For example, for instance, with the bed nets, a few people may complain that when they sleep under, there might be too much heat within or because already they may not have enough ventilation within their rooms.
Are you agreeing with them?
I'm just letting you know the reasons.
These are their reasons.
These are some of their
reasons. Is there
reasons.
Empirical evidence to challenge this? That is, we have tested our nets, we've slept, and we've got people, and we've done a survey which says this is the level of acceptance.
So for those figures, I wouldn't be able to give
because
you
we must be able to bust these.
Yes, there are things that we should actually follow up on, and I wouldn't be able to give you here now and now.
Because we've done a lot of videos and I mean, I can remember even the old lady who tells her daughter that Inimboni, if you give birth and people look at your child too much, they give Inimboni, and then we link it to actually it's malaria and this and that and that. We've done all those wonderful pieces of work, right? So we don't have the data, but we have given out the nets.
Yes. With the antenatal, the nets are available.
Okay.
So when
who qualifies to get a net?
Any pregnant woman that comes to the clinic for the first time, with the registration, is given a bed net.
Okay.
And how to
for free?
Yes, please.
Okay, it's for free.
It's for free
as we speak.
Yes.
Or not? It's not because of the World Malaria Day. It's for free.
No.
It's by policy.
Yes, please.
100% free.
Health, public health facilities.
All facilities, all government facilities.
Yes, that's public health.
Yes.
Right? I'm just distinguishing that from the private.
Yes, okay.
If you go to a public facility, you get a bed net for your first visit.
Yes.
Straight. If you haven't gotten one, please, I will open the phone line soon so that you can tell them where you live.
And the children get it after their, I think it's
the measles too. That is at 18 months.
Okay.
Their last dose.
Okay, so we actually have periods where you are supposed to receive this.
Yes, please.
Okay, is there anything you should do if you haven't received this, though you go to antenatal?
The moment you are attending antenatal, you will surely be given a bed net.
Okay.
And if you always take your child to the child welfare clinic, when you are your child is 18 months, they will surely give you a bed net.
Okay. Folks, if you just joined us, Ultimate Health on Joy 99.7 FM, 33 minutes past the hour of 2 already. I know the mosquitoes are listening, right?
Joy 99.7
But the important
FM.
thing is, this is a major public health concern, right? I pulled back a bit on the statistics because we need to know. We say endemic. Okay, how serious is it now? What are malaria deaths or malaria-related deaths and so on and so forth? Okay, that's how I program for these kinds of discussions. But the important thing is there are things you should know and practice. Okay. Yeah. Currently, we expect you to test before you treat.
Yes.
Right. I'll come to that policy in a second. Okay. Because it's become very easy to just go and treat because you feel you have malaria. And that was one of the reasons driving our drug resistance when it came to chloroquine. Okay? So you are supposed to test, right?
Yes.
And we'll check if people are dodging the test and just going to the pharmacy and buying whatever they should buy. Remember also that we've had subsidized malaria drugs. They were coded green so that people wouldn't make a bob or two out of them. Right? So we've had all those things to make it easier for you and for us to be able to drive out malaria. Okay? In 2026, I'm asking very, very pointed questions about this. Okay? Let me read a couple of the messages. Blessed day, Nortey by nature, and your medical professionals in the studio. I simply can't understand why we should be struggling to deal with malaria in the day and age as far as I am concerned. The major cause of malaria is filth and stagnant water around us. When we were little, I remember town council, say town council, officials who came in our communities to sanction those whose homes and environments were filthy. My simple question is, can't we put in similar measures and severely punish offenders to serve as a deterrent to others? What at all will it cost to stay clean, healthy, and responsible as citizens? This is obviously from Prosper Domenyo Dakuman. Right? So he's saying, why don't we do this? In fact, my sixth form service back in the early 80s, right? I went round the whole of that Kolegona Mamprobi area with health inspectors, right? And they had their summons and all those things, and they were taken seriously. But, well, he's saying we've left that.
Yes, I partially agree with him. So I think that, you see, so malaria is an, let me put it in a way, as an environmental disease.
Joy,
Once
99.7 FM.
For the vector, that's the mosquito. You create a space for the mosquito to live. The mosquito would be there, so the mosquito would definitely go lay their eggs in these stagnant waters and all these things.
You know, I moved briefly, right, or recently to Greda. But let me just take the Kole Lagoon.
Okay.
Let me just take the Kole Lagoon. Right next to Kolebu, where you are celebrating this day. Right?
Yeah.
And we're talking about breeding places and stuff and that. Have you seen that place?
Yes.
Have you seen the mound of filth that has become a mountain?
So
Yes.
Have you seen the recycling center which is bursting at the seams?
yes.
Right. Did you guys march there? I know you had a brass band something. Did you go there?
As-
okay.
as- I earlier said, it all boils down to behavior change. Some of these fields can be managed at home, whereby it won't end up in the
No,
lagoon.
hang on a sec, Victoria. I disagree with you. I've managed it at home. It has been collected, right? And it goes to what is an excuse for a dump, which is being maybe supervised or run, I don't know, by the metro, the council, or whatever. Do you see? Right? Yeah. It is not invisible. You cannot drive on the Mortuary Road and not see that mound up there, right?
Yes.
I don't want to say there are wards in Kolebu that don't have mosquito nets. Okay? yes, please.
You are really familiar with the environment.
I worked in Kolebu. All right?
That's right.
So what are we talking about when we're saying behavior change?
Yes.
Okay? Are we really changing behavior, or are we celebrating a day?
I'll be a little bit candid with you. I think that we are all involved in this.
Joy,
If you look on one of our
99.7
flags,
FM.
a route there that we need community participation.
Okay.
It has to be a partnership between everybody,
Okay.
including law enforcers. We need everybody on board, because we cannot do it alone as, let's say, public health people, where we are supposed to communicate to cause a change in behavior of the people.
Okay.
But when the people change their behavior, and let's say some people change and others do not change, who brings them into line? Who handles that part of the like you are situating these refuse dams and
Right next to
all
Kolebu.
these? Yes. And look at the Kole Lagoon, for example. Who takes the lead?
In other countries, they live in harmony with water bodies. Lovely.
That's true.
Right? You see the River Thames or whatever. I mean, what is wrong with us?
In those countries, they seem not to be polluting the water bodies, because I think that interventions or the laws seem to be working. Let me just choose my words carefully, because over here, if you even report somebody to have dumped refuse in let's say in Kole Lagoon, for example, would the policeman at the Kolebu police station, take any distinct action?
There's sanitation, environmental health, even under the AMA, right? Okay. I can call, she doctor now, Florence Kuchi, right? Yeah. They've been doing a program with Joy FM, going to the markets and all that. There's a department for that. You see, sometimes we run programs in silos. There's a whole school health education program, SHEP program, right? There's a SHEP program. I've worked with those coordinators before, right? So when we are running things and we think that communities are not taking part because maybe we get a little money for these people, they run theirs. These people think they don't have money, they don't have pickups, they don't have this and that and that. That's why maybe we're not making headway.
I could agree there too, because I think maybe it's not well synchronized. Like everybody is trying to do their
But
thing.
then public health should be, should I say, synchronized with the local government system. That's what takes you down. That is why you understand districts, communities, and so on and so forth. And then you can use the community agents to actually trigger the change. Okay. Right?
Okay.
And if you're talking about behavior change, you know, I don't know who's part of the team now, but if you want to change behavior, then you must understand some of the things that are fueling the behavior. Okay? So, for example, my refuse hasn't been picked up, or this and that and that and that. What are the agencies in waste management doing as part of our malaria campaign? All right.
Yeah.
We don't have to leave them out of the campaign. That is what I'm gathering.
Okay. All right, Ziggy, can I have my WhatsApp back? I've seen Dede in Maryland who is back. She's been missing for a while, and you asked me where she was. Okay, please give me my WhatsApp screen. But folks, join us. 40 minutes past the hour of 2. I don't mind doing 2-3 programs on this, and I don't mind bringing in all the big head honchos as well, from ministry or whatever. They can come and tell me the numbers. Okay.
Okay.
Because sometimes we're a bit too, I don't know, laid back, right? Most people will call and say, we want to come on your show. It is well, so and so day. I said, if you don't give me data from what happened the whole year, I won't do it. All right? That's why we need to know these things, okay?
Yeah.
Yes.
Joy 99.7
Data on current and
FM.
past health conditions are very much unavailable because we haven't been able to cover all data sources. Currently, it is very scattered. Moses Geme. What happened to genetically modified mosquitoes? Another strategy. Okay, that was looked at. But please go to CSIR. Moses, I disagree with you. Go to CSIR. Go to our universities.
They are there.
The research has been done.
Yeah.
The data is there. Okay? And in other countries, this will fuel change. But you do it at impartial fulfillment of the requirements for MPhil or and where you
That ends it.
and that ends it, right? And you go and wear a capi or whatever, and you graduated. That is my problem. Okay.
99.7 FM.
03022165541. I'm grilling the mosquito grillers. Yes. Okay. Join us. Okay. So this is what Moses was saying. He says the data is absent because it is scattered. Well, okay. Right. Long time. Dede in Maryland. Oh, Dede, why? What kind of love is this at all? You are not being harsh at all. I would have putting in measures to curb malaria and no statistics on your progress. How are you keeping track of your efforts? Disappointing to say the least. Well, maybe that's why sometimes the U.S. Under a certain nice gentleman says, I won't fund this, I won't fund that. And then our agencies start to scream. Okay? My HIV people, I'm still fighting you people. Ever since funding was cut, please. I did a lot of work in HIV as well. Huh? Okay, so that is from Dede. There was another one about us not having data. Okay, so is it the case that the Ghana, the National Malaria Program would also not have?
Oh, they'll have the data is there. We don't have it readily available.
But how can you be running public health and you don't have a program?
I don't have
data?
it readily available.
Hey, Oku.
So the data, there is data on the incidence of malaria in Ghana.
But how can you be running a public health program
You
and
see,
sitting at our peripheral, in fact, our tertiary gold mine?
Kolebu.
Yes, and not have the
So
data.
you see, you are looking for specific data.
But of course, I'm expecting specific data from you.
Joy
And
That is why you are a doctor and I'm not.
specific data on bednet. So you see, there is a little
Really is
challenge.
crackers.
No, let me clarify that one. There is a little challenge there because you see,
99.7
she's a public health nurse. She can testify that they are currently they are not doing home visits in Kolebu. You see, Kolebu is a tertiary.
Have you been to any secondary school to see if the nets given to the schools are being used? Has anybody been there?
The schools.
St. Mary's is just down the road. Is that the junction? I know that whole block. I've been in every house in that block way back in 1983.
Wow.
Yes.
I was not born then.
Yes. Okay, but the mosquito was born. Yeah. Have you been? I mean, what are we doing on the ground?
Those are to direct you. So you see, the net,
Joy
if you even have to get
99.7
figures on the net,
Mm.
it would have to be on those that are distributed for free. That's the on the under fives and the
Even if they were
mothers.
sold, my dear gentleman, you see, even if I buy it, am I using it right? I can buy a condom and use it wrongly, okay? But you can pat yourself on the back and say, this is the number of condoms that have been bought, right?
Yes, okay.
Okay,
Yeah.
so these are program measures. They are very important measures that we should monitor, right?
Okay. That I agree 100%
So Ghana
with
gets,
you.
let's say, if you're giving, you see, when you hear free, it doesn't mean it is free. Okay,
Yes.
right?
Okay.
Okay,
Yes.
I don't want to get stuck on nets, right? But if you bring it up, then I'll ask you a question about it.
Okay.
How is it being used?
Okay.
Okay, I think my house has mosquito nets. I don't want them in the treated nets.
Okay.
Okay, and so on and so on. What are the kind of things we are learning to change
The behavior
and to inform our strategy so that we can also get to Ghana was part of the development of the malaria vaccine,
Yes.
for crying out loud.
Yeah.
Okay, I know that. I hope you know that too.
Yeah, we played an
Yes.
active role.
So we are still behind. That's my worry. That's my worry, right? Okay, let me look at the pregnant women. All right, we're giving them these interventions at various points. Can we say with some confidence that it is yielding in terms of certain indicators for these pregnant women?
Yes, with the prevalence of the way pregnant women report with malaria as compared to the intervention now, there's a reduction.
Okay.
So you realize that the intervention put in place with the bed net and the SP is helping them.
Okay.
And when they come and deliver, after delivery too, they continue so that the child will take the RTSS and still being protected.
Okay.
So when you look at the prevalence, you see that there's a reduction.
Okay.
So with me, I can say that it has real a positive result.
Okay, positive results. She says you can join us 0302216541. WhatsApp is 05511119997. Ultimate Health on Joy 99.7 FM. In the dock is the mosquito, but the mosquito is quite slippery. So I've got the public health officials in the dock at the moment. They are taking my questions on World Malaria Day and the things we are doing. All right, we are very, very tiwi, willy skin people, stubborn academy people. So, as a friend of mine would say, to be fair to them, Ghanaians too are part of the problem, right? Yeah, they'd rather do certain things or not do certain things. Okay, I mean, those who know me, I fight with my neighbors and other people about certain things, and they think I'm bad news. They haven't heard anything yet. All right, but this is the point. Okay, we are celebrating World Malaria Day under a theme which says driven. We are driven to end malaria. And then what does it say after that?
Now we can.
Now we can. Now we must.
Yeah.
Right?
Yeah.
These things are not chosen
Just
like that.
They
Okay.
mean certain things, yeah.
Okay. So I'm hoping that Ghanaians will join us on the phone lines and share. I got this. This was Nortey, as a teacher myself, I want to know if there's any way they can do something about the mosquito nets they supply. The truth is that most students refuse to sleep in these mosquito nets because they don't allow enough ventilation. Okay, this comes up again. In fact, they are as thick as a blanket. Oh, okay. Solution should be one that comes with comfort and is acceptable. Prosper in Dakuman sends that again. Norte, as a teacher, okay, all right, I think he's typed it twice. Okay, right? So he's still talking about heat under or in the nets. Hey, Ziggy, now you want my eyes too. Okay. Good day, Norte. May I know if the mosquito nets are still imported? Are we producing them locally? I think that's the thrust of that question, right? Ultimate Health. For data on if the mosquito nets are, should first always collect contact details of those they give the nets to, set up customer service centers manned by national service personnel. Oh, national service personnel. Have them call periodically to answer questions. That's one way they can get. Social media is also widespread. They can engineer instant response program. This is from 9 or so. Now, you see, some things are not miracles. Okay, field research, program monitoring is not new. But I bless you now for that. I have a caller on the line. Let me take the call. Where's my call button now? Hello, good afternoon.
Hello, good afternoon.
Good afternoon, sir. Your name and where you're calling from?
I'm Nana.
Nana, there's a bit of background. There's a bit of background noise. Yeah.
Yeah, sorry.
Okay.
I'm on a Masai area, so that's how come.
Okay, go ahead.
On the certain things are not miracle. So they were mentioning a behavioral change in their mind and all that. When you leave people to do as they please, they will misbehave, they will fool. That's how come we have laws to make sure that some of these things do not happen.
Bless you.
So what are they doing? We have institutions that are at different sectors that are responsible for some of these things. What are they doing in collaboration so that we deal with this field situation we have in this country? Because we can't leave it on one person. So what are they doing? It looks like all the institutions who are responsible for this, everybody is working in isolation, and they just cover a little bit of the situation. So I think that if they are doing it in synergy, it will go a long way. And then the law enforcement people, what are they also doing? What are they also telling them that you need to do your job so that some of these things do not happen? It can't be that people come from, I see children from school and they are littering around. People from church and they are littering around. Exactly what are they learning?
All right. Thank you. Behavior change. And we do have sanitation courts, right? And I said, I've seen you've seen the Joy FM thing on markets and stuff like that. You see Florence Kuchi, I've forgotten the whole team at AMA and other places, okay? Tying those things together and synchronizing them with indicators, all right? Nortey, thank you for this program. It may be harsh, but your panelists are not updated on what they want to talk about. It's obvious the challenge we are facing if the doctors are fumbling on what they're doing. I think it's just a day celebration. It appears you are now educating our doctors on what to look out for. Oh, no. Cassandra, no, it's not the case. I've worked and I've retired, okay? But there are things we've done way, way, way back. I can tell you, Dr. Opoku Nimo, Health for All 2000, right? There was a time National Service, I think it still does have a health component where you are posted. I was posted to Mamprobi Polyclinic under Dr. Gardner back in the day, 81, what? I can't even remember. 80, 82, 83, 84, right? But you went round households collecting data, which was, informing the programs we do, right? I've worked at the antenatal at Mamprobi Polyclinic, right? So these programs are there. I'm glad people are bringing them up again. Okay, so we have the data, we have the strategies. And you see, in those days, there was no social media, right? So your information services, Land Rovers with speakers and everything going into committees, that was what we were doing. Okay, so it's not that I'm teaching them, but we've done this before and we've had malaria way back, all right? This one says, good afternoon, Nortey. How are you and your guest? Please, oh, it's gone off. My screen has gone off. Please, when you speak, we can hear you. Ghanaians can hear you, all right?
Joy,
I've left your mic on. I've lost, Hayford, I've lost your message on the screen. I'll read it when I get it back up. Okay, so these are the things. If we have a town council department, don't forget you're paying certain property rates. You're paying other things, right? So if these things are not happening, then we get a bit, should I say, frustrated. Do you see? Okay, so we need to see some kind of synergy so that a doctor has his role to play, a nurse has her role to play. But if they are sitting right next to some humongous, whether it's a recycling plant which has gone wrong or overflown its, should I say, boundaries, right? We have the Kole Lagoon sitting right next to Kolebu, okay, right? Can I march with you guys to AMA and we see what's going on? Do they have the resources? And when our refuse is picked up, where does it go? Right? There are gutters that flow nowhere. They've been constructed, but they're not going anywhere. Right? They're just moving water and then it stops at a point and it backs up. Dansoman was built with its own sewage system. Right? And then it backed up, became stagnant. Now it flows backwards into certain houses. Years ago, I had to do programs on that. Okay, so it does seem that we're regressing, right? I'm glad you're reporting numbers which are good. Okay, when it comes to measles and so on and so forth, we can significantly report those numbers. We'll have to go look at these details and come back. Even if it's a 6-member panel in my studio, I'd love it. Bring all the people who are dodging, right? Yes, so that they can come and answer the questions. Okay. My sister Florence at AMA, you know how we do the things. I see you telling the market women, you are doing tomato paste under these conditions. This is your cornmeal. We've locked it up. Enjoy FM covers it. But maybe we need to drill down a bit harder. Okay, Hayford in Bato, good afternoon. Please, per your explanation, you said that some countries are malaria free. Please, I want to know what they have done in their environment to make them free of mosquitoes, and we can't do it for ourselves for free, or to free ourselves of these problems. Secondly, if we have a vaccine, why have they not vaccinated us in the country to make us free from mosquitoes? Okay, Hayford, I'll pass these on. I don't want to answer. Yes, he's asking, what did the countries do to free themselves of malaria?
It's the same things that we are talking about.
Okay.
Yes, so they have taken.
They've been successful.
Yes,
we haven't.
India, we haven't.
Oh boy.
Yes, that's.
Well, our mosquitoes are different.
The same female anopheles mosquito.
All right. May I know if the mosquito nets are still imported? Are they locally produced mosquito nets?
I think they are locally produced.
Okay, this was from Togbi. Lante says something. Oh gosh.
Please, to add up, he was asking about the vaccine.
Yep.
The vaccine is not for the elderly ones. It's for the
Targeting children.
Yeah, targeted children. That is, it's in 4 doses.
Okay.
You take the first dose at 6 months, second dose at 7 months, then the third one at 9 months, then 18 months you take the last dose.
Okay.
So it's not for.
What is the vaccine supposed to do for you? I wanted to say that for another program. You see, because if I'm taking shots along, you're boosting my immunity. Yeah. That's what a vaccine does.
That's basically
okay.
that.
So, firstly, how are we administering this? Is it free for which targeted ages?
Yes, it's free for children at CWC.
So that's under 5.
Under 5.
The children are the most vulnerable group when it comes to malaria. So that is the target area to make sure that most children do not die from.
We are giving children under 5 the vaccine.
The vaccine.
Yes.
Okay. Now, children under 5 is quite a number. How are we segmenting it? So you're giving the age that they are supposed to take this.
Yes.
Right. So the first dose is
6 months.
6 months.
Yes, please.
Okay.
Second dose at 7 months.
Okay. A month later, you take a
Yes.
second dose. Right.
9 months, they take the third dose.
Okay.
Then at
18 you
months.
take the 4th
So your
dose.
child is attending what we call weighing,
Yes, please.
and they are supposed to get these shots.
Yes.
Okay. Right. After the full 4 doses, is it the full 4 doses?
Yes, please.
Right. Then what, you are deemed to have full protection? Will you need to do?
No vaccine gives you 100% protection. It sort of gives you some amount of protection, and then that is why we give them the bed nets afterwards too.
But do speak to this specific vaccine. I know the name of the vaccine, but speak to it.
Okay.
All right. What is the literature telling us? It will give what degree of protection to these children? You see, when you want people to go for these vaccines, you must promote it based on empirical evidence. The vaccine has been demonstrated, right, to give this kind of, otherwise we wouldn't have taken the COVID vaccines. Do you see?
Yeah.
Right? So it's a bit dilute to say it's not full. I know vaccination is not full protection, right? But we need to let our people understand these things so that they will present their children. Because there are people also countering the information and education we are giving out. Do you see? Right? So you must come armed with that kind of information so that we can really stand on it and say, everybody get that jab. Right? Because we're learning that it being free hasn't crossed the kind of threshold we wanted to cross. Okay? We are grateful it is free. It's a great policy. But let's, should I say, strengthen it with the information. Right? Ziggy, I've lost my screen again. Okay. So we've got this for the kids.
Okay.
Yes.
Right? Across the country.
Yes.
Yeah? The whole Ghana.
Yes. It was first piloted in 2019,
Mm-hmm.
and some of the areas that are high, they have this high risk
Mm-hmm.
people there. So after it has been piloted, it's now at all the CWC services.
Mm-hmm.
So when you go for weighing and your child is due,
Child wellness clinics.
yes, please.
Mm-hmm.
When your child is due, they give it to you.
Mm-hmm.
So this RTSS,
But it's
Yeah.
not the full. It's not nationwide, is it? Is it currently nationwide? It's not.
Oh, it's part of the EPI,
EPI
program. So
program.
everywhere that we this our immunization stuff go on,
Okay.
everybody gets
Is
access to the
Okay.
vaccine. Yeah.
All right.
So the protection, just to chip that in, it offers about 50% protection, and the protection is known to wane down after taking the vaccine. And
Okay. With such a child who has gotten the cover we're talking about,
Yeah.
albeit 50% protection, will they be required to take boosters of this vaccine, or will they just go to the same regimen that all adults and other people are using?
So so actually the continuations are sort of serving as a booster. So actually the 18th month dose is the booster dose. So
Okay.
after 9 months apart, then
Okay.
you take the 18 months.
Great stuff. Okay.
Booster dose.
What I'm going to do is, with your permission,
Okay, sure.
okay, I would want the public health team. This is just Kolebu, okay. It may seem as if I'm asking you to speak for the nation, all right. So pardon me for that, but let's do another program, and I'm going to focus specifically on the pregnant women, right? Get a better understanding of the vaccines and the nets.
Okay.
Okay. My little reading, right? We required a significant partnership to do the indoor spraying.
Sure.
I don't know whether it's still running. Okay, we'll check on that. But definitely, you have another free program, another hour with me and my guests, so that we can tidy up, dot our I's and cross our T's on this. It's not the case that you are not doing anything, but if you are doing something, you should be able to demonstrate it proudly, confidently, because the people they are stubborn. They are stubborn. That's why we have behavior change. But
Yes,
behavior change follows certain known principles. Okay, I'll pretend I'm not a clinical psychologist, right? But it follows certain principles that make it a bit easier, though it still requires money and resources. To the folks at the ministries and the Ghana Health Service, I know you guys are there. There's a reason sometimes I avoid, because you people come and you don't want to take the blows, right? Yeah. So I like people like clinicians and other people, nurses on the ground. They speak, and don't go giving them heat. Otherwise, I'll come for you. All right. Thanks, Victoria. Thanks, Prince Henry. This is Ultimate Health for today, right? The mosquito is stubborn. People are making money out of mosquito coils. Next week, I'll tell you whether those coils work at all, because the mosquitoes do dancing and break dance and all sorts of things on it, right? We'll find out what we're doing and if it's working. Stick and stay on Joy 99.7 FM. My name is Nortey by nature. I'm out like that. It's Coco for my God, but not always. Stick and stay. You wanted to say something?
Yeah.
Okay.
What I want us to do is, with this Malaria Day we are celebrating, we need to drive at some of the things. First one, we have to sleep under treated bed nets always.
Okay.
Then we should make sure that we test before treatment. As you said earlier, some people just go to the pharmacy shop, over the counter shops, get tested of malaria. Some of the parasite, they only test for falciparum. Other species of malaria parasite is there.
You see,
So
Victoria, I'll pause you here. I've offered you a whole program.
We will come again.
But if we get stuck in the basics, that is why these ones. I know what test, detect, test, treat means, okay? But you see, if you get caught in your own mosquito net, then we will not get to the point you are getting to, okay? And my bosses here will start calling me that it is 4 minutes past 3, okay?
okay.
They will detect me and treat me. So don't worry, next week we'll go into those
we
portions.
should go into the
But you
details.
do have to establish a foundation,
Sure.
which makes now what you are saying sit on something. That's what my point. Okay.
Okay.
All right. Thank you so much. Stick
Thank
and
you
stay.
too.
Yeah. Stick and stay, guys. I'm out of here with the mosquito.